Partnered by Times Influence.
The Times Health Excellence 2018, conceptualized by Optimal Media Solutions, applauded and felicitated the leading healthcare providers of the city of Bengaluru for their outstanding achievements and contributions towards society. The evening saw presentations from leading healthcare professionals who have pushed all boundaries to nurture a passion for innovation, continuously seeking a holistic development of our nation.
If we were to take the 27.5 million and we say that in 27.5 million we've only touched 1% of that population, and that 1% of population comes to about 2.7 lakhs. So what happens to the remaining? We have still not actually addressed that. So if you look at couples coming for evaluation, it will be 1%. But if you look at couples actually availing of treatment is only 65,000. And the number of IVF cycles as of 2015 was about 1 lakh cycles in the country. So which means that there is a huge unmet need that we see today and opportunities for the industry. Most of them think that infertility is because of stress, age of the woman, working couples, age of men. But a large area of obesity, alcohol misuse, and of course, hereditary conditions, lifestyle which is poor, and diet, lack of exercise also forms a huge part. Awareness of infertility treatment, spontaneously aware that there is something called infertility, 100%. More than 50% still have reservations of surrogacy, donor egg, and donor sperms. Not having a baby is a huge issue. So need for parenthood is very important to have because it becomes a social status of being a mother, a father, and therefore it is very, very important. However, it is not as much valued in the West as much as it is valued in the Asian countries. ART, that is infertility practice, is a huge market.
I would like to invite on stage our Honorable Minister for Statistics and Program Implementation, Shri D.V. Sadananda Gowda, to address the gathering.
Medicine indeed is a noble service towards humanity, and each of the healthcare professionals present here today have made a considerable contribution towards making the world a better place by saving many from disease, illness, and even death. Health is one of the most critical of all factors. Once it is lost, everything, including the joy of living, is lost. I would like to congratulate the eminent medical professionals here today for their joint achievement in putting Bangalore on the map, on the top of the map, when it comes to healthcare. Renowned hospitals in the city are known to constantly upgrade their technology to be on par with the international standards and firmly uphold world-class quality services while performing the most complex surgeries. Thank you, one and all.
Sir, thank you very much for those wonderful words of wisdom. If I could request you just a few moments to stay back, to help us with the Times Health Excellence 2018. To these doctors for their contributions and achievements. We would like to honor, first of all, Dr. Punita Rangaraj from Bellevue's Cambridge Hospital Infertility and IVF Center for their service excellence in infertility and IVF care. Mr. S.M. Raju, IAS, Miracolo Drinks Private Limited, Miracle Drinks, for their service excellence in inventing herbal compounds for incurable diseases. Dr. C.R. Chandrasekhar, Samadhana Clinic, for their service excellence in mental health. Dr. Sharan Shivraj Patil, Sparsh Hospital, for their service excellence in orthopedics. We would like to honor Dr. Dinesh Kinney, Sakra World Hospital, for their service excellence in gastroenterology. Dr. Adil Sadiq, Sakra World Hospital, for their service excellence in cardiovascular surgery. We would like to honor Dr. Anita B.R., Femint Health, for their service excellence in obstetrics and gynecology. Dr. Shashi Kumar V. Meherwade from Tapawana Ayurveda Medical College and Hospital, for their service excellence in Ayurveda services. Dr. Jyoti Jha, Femint Health, for their service excellence in cosmetic and plastic surgery. Congratulations and a big round of applause, ladies and gentlemen, to all our achievers for their outstanding contributions. She's an individual who needs no introduction. Her name resonates in the hearts, and her contributions not only in the healthcare industry, but in society in general. Women welfare development have been heard, reciprocated, and made our country proud. It is an honor for the Times Group to present its first ever Lifetime Achievement Award for IVF and infertility care at the Times Health Excellence 2018. Ladies and gentlemen, an inspiration, a leader, a role model, a huge round of applause for her lifetime achievement in IVF and infertility care, Dr. Kamini A. Rao.
The topic for my discussion today would be the new frontiers in cardiothoracic surgery. Cardiac surgery has changed a lot. There was a time that cardiac surgery could never be performed. We have more than 200,000 cardiac operations being performed on an annual basis. India is leading in the number of diabetic patients across the world. This, in addition to all the lifestyle changes and the IT crowd put in with the long working hours, all of them is actually eating up our population. The average age of the first heart attack in Bangalore 20 years back was 56. Today, it is less than 40. It is 38 years old. There's a whole new equation in cardiac surgery thanks to least invasive surgery. The first and the most important benefit for all our patients is faster return to normal activity. Lesser antibiotics use, lesser use of blood transfusion, less pain. We use specialized instrumentation to synergistically manipulate the heart. So the traditional approach whenever you have an aortic valve problem is to replace it. There are disadvantages of both the mechanical and the tissue valve. And the repair has been attempted for quite some time, but none of it has ever been successful. Dr. Ozaki, one of our counterparts with CCOM in Japan, has been doing a certain technique since the year 2007. So an overview of what the Ozaki repair means is that we take a piece of the covering of the heart called the pericardium. That's the first slide. We put it in a proprietary solution with a basis of glutaraldehyde to strengthen it and make it last 20 years. Then we open up the heart, take out the diseased aortic valve. That particular valve has rheumatic heart disease, very common in India. Once we excise that, we use patented sizers to measure it, draw them out just like some of the kids use a stencil to cut out pieces of pericardium, and we sew it back in to get an absolutely brand new valve. The first and most important thing is the biocompatibility. You're using the body's own tissues. Just imagine if you're putting a cornea for the patient from the patient's own cornea. So that's what it is. So the chance of rejection or any other problems is almost zero. Second, most importantly, there is no need for lifetime anticoagulation. A tissue valve, which does not require the anticoagulation, costs around 2,78,000 rupees. How much does the Uzaki cost? Nothing. So for the Indian scenario, this is a big game changer. The only constant in any sphere is change. We need to change with the times. We need to adapt to the times.
Group of cells are tissue. Group of tissues are organ. Cell required nutrients and cell required proper cellular metabolic activity and cellular respiratory system, and it has to be detoxified properly. So from where nutrients comes? Automatically it is in the food. So the biggest challenge is the food what we are consuming is not properly breaking down in the gut system. So now in the gut system, 10 times of our cells and 500 variants, beneficial microbes are there, which are releasing the enzymes, and accordingly, whatever the God-gifted food is there, if you take, it is being break down and ensuring those nutrients to different organs according to the requirement. Everybody knows that calcium deficiency causes bones and joint problems. Why can't we treat through that calcium? God has given some other nutrients which are not able to diagnose it from the food. So that we have to ensure to get released from the food. Within our home, we are having flax diet, which is having abundant lignans. So through lignans, we can detoxify the cell as well as beneficial bacteria. We have to feed the food to the beneficial microbes. That is garlic, ginger, and fenugreek seeds, that's the methi, sweet potato, and banana. The quantum of the omega-3, omega-6, and lignans one can get, the quantity which is available in 1 quintal of peanuts, or else 2 kilo of salmon fish, or else 12 kilo of cashew nuts. So these things are abundantly available in flax diet.
I felt so happy that the Times Group has given such a new direction, such a visionary ideologies to the whole healthcare system.
It is important that infertility has been recognized by the media as a disease, because all too long infertility was a bedroom scene rather than a boardroom scene, and thanks to the Times Group you brought it to the boardroom so that people can talk about it.
It was a great opportunity for doctors to come and meet up with the media as well as people from different realms of society, including the lawmakers and policymakers. So I think it was a fantastic platform to share information and let your point of view be heard, as well as interact with them on a one-to-one basis.
And now, for that, food is required. The food is in our house only. That's what we call prebiotic. The garlic, ginger, methi, that is a fenugreek seed, and sweet potato, banana. These things are basically food for the microbes. So if you take this food, automatically it will release good enzymes. Automatically, whatever the food you eat, it will get breakdown properly and supply to the organs.
So treatment of depression, one is medicines, second one is counseling.
The Times Health Excellence 2018, held in the city of Bengaluru, showcased innovations that are improving the efficiency and enhancing the experience of patients and other stakeholders in the healthcare industry.
10% of Indians are depressed today. But in our country, majority of the patients do not want to accept that they are depressed. What are the features of depression? Persistent, sad, anxious mood or empty mood, hopelessness, irritability, guilt, feeling, worthlessness, loss of interest in hobbies and activities, decreased energy, fatigue, moving or talking slowly, restless, decreased concentration, memory, decreased ability to think, analyze, take decisions, sleep disturbance, appetite disturbances, thoughts of death and suicide, aches and pains, other physical symptoms with no cause in the body. So treatment of depression, one is medicines, second one is counseling, cognitive behavior therapy or interpersonal therapy. Then we have to increase the coping skills of the individuals. Then in severe cases with psychotic symptoms, ECT, electroconvulsive therapy helps a lot. Or RTMS, repetitive transcranial magnetic stimulation done in psychiatric institutions. Yoga meditation also helps depression and hobbies and recreation. In India, we have only 4,000 psychiatrists for the whole country. Only 4,000. We have 1 or 2 psychiatrists for 10 lakh people. And all the psychiatrists are located in big cities and big towns. All doctors who are practicing anywhere, and also in cities where specialties, super specialty hospitals are available, unfortunately, psychiatrists are not recognized, and also referrals to psychiatrists usually resented. So don't send me to a psychiatrist, I'm not mad. I'm not mad. So I request all the doctors to treat depression, because you are the primary care giver or person who can treat people who are depressed.
Gastroenterologist was considered as a doctor who treats patients with diarrhea or acute gastroenteritis. No dedicated, really specialized gastroenterology departments across Bengaluru city, I would say across Karnataka. This is the scenario in which I landed in this city. The first initial challenges in the first decade have been creating the awareness of the specialty among doctors and also telling them what is the scope of services for a gastroenterologist. What can he do for patients to get well and how to diagnose conditions. So we had to hold various meetings in various forums among pediatricians, physicians, surgeons to tell them and present certain interesting patients we encountered and also hold some seminars and improve awareness among doctors. The major problem which we encountered among adults is a lot of patients with liver disease, which constitutes about 40% of our day-to-day practice, used to come with swelling of the abdomen. We call in medicine ascites. Liver transplant was never heard of, never given as an option to these patients. I started using protein infusions for them weekly or once in fortnight intravenously as an outpatient, and we improved their survival. Of course, it won't reverse their liver condition, but they started living they used to die within 3 to 6 months. Here they started surviving for more than a year, at times 2 years. It improved overall survival. That also prompted me, of course, they used to die after 1.5 to 2 years. We said I should do something different. We started this procedure called TIPS in these patients, where we radiologically put a stent between the branch of the portal, hepatic veins and portal vein, reduce the pressure within the liver, and thereby reducing their ascites formation. And subsequently, we made this facility available in Bangalore. I'm so glad and so happy. Now this procedure has become very standardized. Most corporate hospitals across Bangalore are able to perform this, which salvages a lot of these patients with end-stage liver disease. Gastroenterology has moved from treating, managing diarrhea to complex GI problems with availability of state-of-the-art endoscopic units all across Bengaluru, not only at Sakra, various centers are doing. And various liver transplant units are doing a fantastic job in the city. Bengaluru is becoming a leading destination for gastrointestinal problems within Karnataka and across the states. Bengaluru has a more potential to become a final destination for, as a medical tourism for GI conditions. We can attract a lot of although they're coming to Bengaluru, we have much more larger potential to make Bengaluru a final destination for all complex gastrointestinal problems.
This brings us to the last leg of the evening, ladies and gentlemen, and I invite on stage Ms. Chandrika Ravi. Firstly, we would like to honor Dr. Bani Anand, Hairline International, for their service excellence in trichology. Unfortunately, Dr. Bani Anand could not join us this evening. On her behalf, we have Dr. Dinesh Gigi and Dr. KG Divya representing Hairline International. Dr. Kirti R. Patel and Dr. Sangeeta Patel, INXS Anti-Aging and Obesity Clinic, for their service excellence in skin and derma. Ms. Aarti Singh, Spara Aesthetic Studio, for their service excellence in aesthetic. Dr. Sandeep Nayak, MACS Clinic, for their service excellence in oncology. We would like to honor Dr. Naeem Sadiq, Plexus Neuro and Stem Cell Research Center, for their service excellence in neurology. I now invite on stage Dr. B.G. Prakash Kumar to honor doctors with the Times Health Excellence 2018 for their contributions and achievement. To start off with, we would like to honor Dr. Anita B.R., Femint Health, for their service excellence in infertility care. Dr. Mahatesh R. Charantimat from Tatgat Heart Care Center and Hospital, for their service excellence in cardiology. I now invite on stage Mr. Om Pradut to honor our doctors with the Times Health Excellence 2018 for their contributions and achievements. Dr. Parthasati Datta Roy, Asian Hair and Skin Hospitals, for their service excellence in dermatology and cosmetology. Dr. G. Moinuddin, Gleneagles Global Hospitals, for their service excellence in bariatric surgery. Dr. Maharishi Anand Guruji, A&J Healthcare, for their service excellence in Ayurveda medicine.
It can be a good platform for recognizing talents and also make them reach the public and population in a metro city.
Whenever the technology is improving, that has to be brought to the notice of the public. So media is one of the important thing that will communicate to the people what are all the things done by the doctor to the community and what are all the importance of the treatment in the community.
Whether you're a doctor, whether you're a teacher, whether you are an ordinary person, think about depression, identify depression either in you or in others, and help them.
I got a lot of informations about the medical informations about sugar or like diabetic or gastritis, and this was one of real learning, something to learn about it.
Did most of our training in cosmetology in Paris. We wanted the Indian people to experience Paris in India.
We waited 20 long years, to get appreciated, and to be appreciated by Times is such a feather in our cap.
It gives me immense pleasure to receive this award. It is in recognition of my work in obstetrics and gynecology and also in the field of infertility.
This is very motivating for young doctors and entrepreneurs in the healthcare sector because it motivates us to do a better job, work towards our goal to achieve the patient satisfaction. So it's definitely a pleasure to be on this platform.